Hello, good morning. Thank you to everyone who was able to join us today for Can Contact Tracing Deliver Value in the COVID Era, a Health Innovation Alliance webinar. For those of you who may not be familiar, the Health Innovation Alliance is a DC-based advocacy focused coalition. We work on policy, advocacy, and development on all issues at the intersection of healthcare and technology. We're very excited today to be here with our panel.
It is a tool of oppression.
I'm sorry, I'm getting
it's very much at home in the home.
I'm getting some feedback. Thank you. If you're not if you're not speaking, please go ahead and put yourself on mute. And just so everybody is aware, we are recording today's webinar for future use, and we appreciate everybody taking the time to join us. So without further ado, our esteemed panel that's joining us today to talk about their expertise in contact tracing includes Dr. Sarah Lasky, a senior XM scientist at Qualtrics. Thank you, Sarah. Rafa Hassan, senior director at Microsoft Research, and Gregory Lisiak, digital advisor at healthcare at Microsoft. So we're very excited to have this panel, and moderating our discussion today, which we hope will be fruitful and interesting, is Mr. Brett Meeks. Brett is a senior advisor to the Health Innovation Alliance. He comes from years on the Hill, has a deep background in healthcare technology, expertise in privacy issues, and a whole number of topics that I think will be relevant to our conversation today. So we're excited to have you. And just a few housekeeping items. If anybody has any questions, please feel free to submit those in chat. You can send them directly to me. I'm Allie Wills. I will be moderating and fielding those. And then you can also unmute yourself. At the end of this panel discussion, we'll be having an open Q&A. So with that, I'll go ahead and turn it over to Brett. Thank you.
Thank you, Allie, and good morning to everyone. Thanks for joining us. We know everyone is very busy between keeping up with all the goings on in DC, in the policy world, keeping up with the pandemic, caring for children, families, loved ones, and making sure everyone's safe. So thanks for taking the time out this morning. As Allie mentioned, this is being recorded, so if you know folks that might be interested later, please share it. And we wanted to do that so folks that weren't able to join could access this. So contact tracing. We hear a lot about this in the news. There's a different slant, it seems, every single day. It's very, it's an important topic to discuss, especially from the Health Innovation Alliance perspective, because we try to drive technologies to improve the delivery of healthcare to bring better outcomes. And contact tracing is a great topic to focus on because it's incredibly timely because we're in the middle of a pandemic, and we're seeing some struggling amongst different jurisdictions in our own country and internationally on how to approach this. But basically, contact tracing has been around for decades, if not centuries, depending on how you read. Going back to the bubonic plague, there's a lot of isolation. It was instrumental in smallpox treatment in the late 18th century. And then the syphilis outbreak in the early 20th century. But the basic fundamentals haven't changed over the entire time frame. It is who has a contagious disease and who have you come in contact when you have that. So for the most part, today what we see is local jurisdictions, mainly state governments, carrying this out, usually by calling people who have tested positive for COVID, the current contagion, and tracing where they've been, who they've come in contact with, and who they might have exposed, and then asking them to self-isolate or quarantine until they're no longer spreading the disease. I pulled up, I'm in Nashville, Tennessee, and each state has its own way of running these things, but I pulled up a contact tracing guide that they have, and I just wanted to, I know everyone's familiar with contact tracing, but the questions they say in the suggested script is, I'm going to ask you to think back over each day while you've been sick, and even a couple of days before, to remember what you did each day. This will help us figure out who you may have been around, who else might get sick. If you're having a hard time remembering, sometimes it helps to look at a calendar or on your phone for messages sent, or even at your credit card receipts. We're happy to give you time to consult and get this information. When it gets down to the specific questions, you realize this stuff gets very personal very quickly. Where did you wake up this morning? Was anyone else staying in the same place as you? Where did you have breakfast? Did you dine with anyone? So it's literally, it is following your activities to see who you might have exposed, which makes sense. And obviously inherent in some of these questions, you know, check your phone messages, check your credit card activities. These are things that generate electronic logs that it is just natural to think, wait a minute, we have very advanced technologies that most people carry around in their pockets that could help us with this. But so far there's been, you know, some mixed reviews, I'll say, on how to best use technology to improve tracing. So right now it's still, you know, it's more or less a phone call and logging the interactions with people. So, you know, the last thing I'll say is we actually experienced this, just to make it personal and very real. We had a potential exposure in my family, and we had the state health department call us and go through, all right, where have you been? We did not test positive, everyone was fine, but there was a potential exposure. And it was fortunately very simple for us because we've been home and we haven't seen anyone. All our groceries have been delivered, much like most people. But it becomes very real very quickly. And contact tracing is seen as, you know, one of two fundamental pillars to really stemming the tide of this outbreak and any outbreak. The first is testing to make sure that we know where the outbreaks are, and the second is tracing the individuals who are positive.
It seems like Brett has frozen for a minute.
Yeah. So we'll troubleshoot. We'll let Brett catch up. I think he was giving some background, but I think we can just take the opportunity. Sarah, I think he's probably going here. Brett, are you back?
Yeah, I'm sorry, did I fade out?
You did. You froze for a second, so we were just going to steal the opportunity briefly to do introductions.
Yeah.
We'll get in. So with that, maybe we can start with you, Sarah, and then Rafa and Gregory.
Absolutely. I'm really excited to be here. I am an emergency medicine physician, and I work with Qualtrics, which is an experience management company. And we have been developing a number of both free and paid solutions to help with the COVID crisis. Everything from a remote workers' pulse through a testing and assessment solution that we've rolled out in the States, and then realized that we needed to approach contact tracing and symptom checking and certification as really the next steps. Brett, if you're okay, I am a visual learner, and so I want to show a couple of slides that will really help to explain what we've been doing at Qualtrics.
Absolutely, please.
All right, so I'm going to go ahead and share my screen. If anyone can't see it, or if there's a problem, please chat me quickly. So
Coming through.
When we looked at the whole COVID situation, we realized there were multiple steps. From, as you said before, testing, which is really a critical component, and then into contact tracing, which for us, we had the point of view that this needed to be really an opt-in, confidential plan that also needed to connect with everything else that everyone was doing, from Bluetooth apps and geolocating, which we haven't done, but also create something that will be useful in the future. I think one of the things that's really interesting about COVID is older diseases that we are more comfortable using contact tracing for. We have a much longer time between transmission of the disease. COVID happened so quickly, and so we need something quick and immediate to take place. So what we did is, speed, obviously important. We created something to integrate with anyone's systems, something that could scale. We know there's been a huge amount of money spent on manual contact tracing because that's the most traditional kind. So we wanted to be able to scale that. And then we wanted to make sure that what was being done was effective by driving all this information to a single source that public health organizations, universities, school districts, employers could utilize. So what we have done is we take all of the information from testing that can get uploaded to us, and then that creates a database of the cases. The cases are then notified by either email or SMS. We have found that people are less likely, although you mentioned that you did, to pick up the phone if it's a telephone number that they don't know, but more likely to respond if you're doing an outreach through the comfortable means for them about their health. From that point, we can identify their contacts through the survey process. We can also identify other community needs that they might have, like transportation to the doctor. And we can also then identify people who aren't responding and send them to case managers. So once we have the contacts into the database, we can then send out information to them, notifying about exposure, tracking over a period of time symptoms, and also getting them into testing through an embedded scheduling piece of our solution. And so the 14-day quarantine critical. People who don't respond, though, we want to have a way to identify those people and get to them, because there are some people who aren't going to be comfortable with technology, and we need those manual tracers. But we want to make sure that that's a focused point. And so we push that critical information to those tracers, and then those tracers can reach out additionally to any at-risk cases or at-risk contacts. So that is basically how our product, our program, our solution is working, and we have seen a lot of success so far. And I've been, as a physician, you want to be on the front lines, but it's also a little nerve-wracking. I think we've seen the intensity of this epidemic, and the ability to be able to impact and help thousands and hundreds of thousands of people get through this pandemic has been, for me, very satisfying, and has really made a difference. So I'm going to turn it back over.
Thank you so much, Sarah. So Rafa and Gregory, we'll hand it over to you to talk about what Microsoft is doing. And thanks again for being with us this morning.
Yeah, sure. I'm going to let Gregory lead here with some of the solutions that Microsoft is coming out with to help in this pandemic. And we have a breadth of solutions. And then I'll talk about some of the volunteer work that has been tremendous in Microsoft, and the kind of collaborations we're doing with various partners and academia. So I'll let Gregory lead, and then I'll chime in with some of our volunteer work as well.
Sure. Thanks, Rafa. So I'm Gregory Lysiak. I'm a digital advisor with Microsoft in the healthcare group. And so my background, I have 20 plus years of technology strategy, solution design, and delivery experience. The last 12 years have been focused on working specifically with healthcare provider and payer organizations. So earlier this year, obviously the pandemic hit, and I spent most of my time, March through end of May, supporting healthcare organizations around the world respond to the COVID-19 pandemic. And I'm going to share a screen here real quick, and that gives a sense for how Microsoft has approach, delivering COVID solutions to the marketplace. So with COVID, as everyone knows, the biggest issue was disseminating information, helping individuals assess and triage potential symptoms for COVID-19, and naturally keep them out of the care facilities. And so early on, it was about information dissemination, helping organizations continue to deliver care, but do so safely. in engaging those patients. Another big area that we focused on was crisis communication and really bringing together the critical information about assets and supplies within the facilities and making sure that hospital operations were able to continue to support the ongoing and increasing demands of their patients that they're treating in their facilities. And then, of course, it moved on to empowering the care teams to just work and other administrative staff to work securely and remotely. And through all of this, it really was critical to ensure that we're keeping the privacy and security of the patient's data and the healthcare systems along the way. And as that unfolded and grew, the challenges continue to mount, and that's where we started looking at, well, how can we enable contact tracing and do it better and more efficient and at a quicker and broader scale. And from there, it was how do we help facilitate and support public health agencies with testing, setting up test sites, and being able to manage that volume of individuals seeking COVID-19 testing. And so that really spurred and sort of that transition from the initial crisis response apps to helping make the public health agencies jobs easier as things continue to explode from a pandemic perspective. Rafa?
Sure. So let me complement a little bit what Greg is saying with some of the volunteer work that's coming out of Microsoft research and across a variety of Microsoft divisions, actually. So I'll just share something which volunteers of Microsoft are working with the University of Washington on, and it's inspired by what Brett started this conversation with. Greg, if you stop sharing, I'll share the 1-2 slides that I can on this one. And this is an mobile application which volunteers from Microsoft are helping University of Washington create. And the reason why we embarked on this with professors from University of Washington's Computer Science and Faculty of Medicine is exactly what Brett started this conversation with, which is that when in manual contact tracing, when you're contacted to conduct an interview, these interviews tend to be lengthy, and they really rely heavily on your memory to remember, like, where are the places you've been to and who all did you contact. So often it's very frustrating for the individual being contacted, as well as for the public health official on the other end who's trying their best to kind of collect this information and have it logged so that they can communicate with other contacts and they can expose public places where infected individuals may have been. And so this volunteering is happening with University of Washington to create a mobile app, which is very simple actually in its technology. It's an app that you opt in you choose to download, and you choose to allow it to record all the places you've been to, and it also helps you, every day say, I met with Sarah for an hour, I met with Gregory for an hour, and then the next day you can kind of log. It's a diary app that allows you to kind of log your information, so that if you're infected, on your phone, you basically have all the information to answer the contact tracer's interview or, quarantine and isolation questions if need be. And the other thing that we are working on, this is still in progress, this Common Circle Assist app, is this ability for public health officials to send community messages out to say, hey, you know, Traders Joe and Chelsea is closed for 2 hours for cleaning because they were infected individuals. And the key thing of this app that the University of Washington and with volunteers from Microsoft Research and others were keen on is that it does it whereby these community messages are sent to a public server and you as a phone user download them, and all the filtering is done on your phone, so your location data is not shared with anybody. So that's one example of sort of this you know, community volunteer work that's happening across the company. And we have many others across the board, from, you know, AI to help with tracking the virus, to also helping, you know, with identifying genetic constitutions of the virus. And so it's been a wonderful experience to really see how many volunteers are up for the challenge, and they just were scratching their heads since March saying, how can I help?
Great to hear. It's always good to see the good things that come out of people in trying times like this. So thank you for that. So I want to move into, you know, some Q&A or sort of discussion amongst all of us. And I want to start pretty generally. You know, thank you for reviewing the work that you all are doing. I'm curious, are these business lines that either of you had worked on or had in place for other disease outbreaks, you know, like tuberculosis, for example, and latent tuberculosis and TB tracing is something that's pretty common and hasn't gone away. But I'm wondering if this particular solution was something that you had in place and adapted, or you just recognized there was a need for your customers and quickly decided to start working. And I'm happy to, whoever wants to answer first.
So I guess I'll start. So Microsoft as an organization, I mean, we embrace and promote innovation, and pretty much none of the solutions that we've deployed in response to the COVID-19 pandemic were solutions that were already, you know, developed. It was the innovation of a number of, you know, lots of individuals, you know, volunteers that have dedicated and committed their time to responding, that created these crisis response solutions. And over, you know, the several months, you know, so March 6th was, you know, the release of a healthcare bot for doing COVID symptom assessment, and from there it just continued to unfold. And as over time, we, you know, you saw overlap with some of the solutions. You might find 3 different groups created something that, you know, did mostly the same stuff, but then, you know, one of them became that marquee or that core product. And over time, you know, we innovated on those solutions in order to build more refined solutions. And that's where, you know, things like our at-risk identification tracking solutions and testing solutions, you know, were spawned, you know, from that iterative process of innovation amongst our volunteers. So I don't think any of these solutions were actually developed previously, but rather just a response to the pandemic.
Great, thank you for that. And I feel like that serves as a good backdrop that the healthcare industry does amazing things, but you really need innovative thinkers and technologies and companies out there to respond to stuff like this and the growing challenges we face at our country, just keeping up with the needs of our population in terms of healthcare. So Sarah, what about Qualtrics? Is this something that
Qualtrics got involved pretty early on when we were part of a coalition that developed an end-to-end solution for the state of Utah, and then that also went to a number of other states. I think while much of what we're doing is new, the solution itself and our product was so well suited for both getting ourselves out there quickly and being nimble enough to change as the pandemic developed and also as the needs of communities developed. So one of our early sites was a city in Indiana, Fishers, Indiana. And they came to us and they wanted to be innovative, and we set up this end-to-end solution, including testing, assessment, tracing. And then they also decided they wanted to pull in employers. They have a big employer base in their town, and needed a way that employers could participate too. And so we just kept sort of expanding our footprint of what we could do, using a lot of the technology and the nimbleness of our technology to be really responsive. So part of it was a combination of thinking about what's next. Part of it is sort of a very Qualtrics-centric, what's the voice of the customer? What's the voice of public health? What's the voice of the universities and the employers? What do they need? And how can we help provide them? And in many cases, work with them. The first place we did major contact tracing was a county in Michigan. And I think we were all surprised that we were getting a 90% participation rate. But it really told us that this sort of opt-in, confidential, easy to use tool was a really good way for us to continue to move forward. Now that was a rural county, but even in some of the very urban places that we have rolled out, including the county where Houston is located, we're getting 40% response rates. That is pretty amazing when you think about all of the news and all of the concerns about privacy and how is my data going to be used and where is this information going and is somebody going to track me? I mean, America definitely has a big brother complex. So things that have potentially worked in other parts of the world, APJ to a certain extent, places in EMEA, aren't going to be as successful in terms of adoption in the US. And so that was really a big drive for us as we continue to develop our solutions.
Great, thank you. And you sort of headed me off to where I wanted to go next. To the extent you can talk about your customers or where you're working, I'd love to hear, who you're working with and if you've seen sort of differences in how they handle this. Contact tracing historically is a localized effort. There's federal funding for it, but health, safety, and welfare in our country lives at the state level. So it's got to be run by the states. What Tennessee is doing where I live is very different than what Houston might be doing. So Sarah, are you able to talk about, you already mentioned Michigan and Houston and the different adoption rates, but are there other markets you're working in, and have you seen differences in the need or what they're asking you for?
Yes, so we've been fortunate that we're really sort of spanning, as I imagine Microsoft is as well, sort of coast to coast in North America. We have not had any issues with public health departments or states or local communities having an issue with what we are doing, which has been great. There is a certain amount of education, I think, within public health around how to best use technology in order to enhance their efforts and scale their efforts. Because as you said, this is not a new process. It's been really fascinating. We have another place in Indiana, another county that we are working with, and they have been, as well as Houston, have been very innovative themselves and really broadening their understanding of how, once this pandemic calms down, we can use the same technology for tracking and tracing vaccines, for looking at things like STDs, HIV, hepatitis A, other foodborne illnesses, driving into community needs and pulling in voice of the community. San Mateo, California is another good example of a place that we are up and running. I think that's the other thing that's been a benefit for us is how quickly we can stand up our solution. We have, in Fishers, as I described before, it took us 5 days from the time we said go to the time they were able to first start assessing, testing, tracking, tracing. And I think that is really helpful because a lot of places have spent money on solutions that aren't up and running yet.
Yeah, I can chime in a little here, and we've had the same kind of experience as Sarah on the Microsoft solution, like our test registration and our lightweight case management system for manual contact tracing. It's called ARIAS. From the day where our disaster recovery team kind of spun up these solutions to actually deploying them was done in 12 weeks time. Like, and they have over 16 states deploying these test registration and lightweight case management system for manual contact tracers. And I 100% agree with Sarah that the public health officials are really, eager to establish end-to-end solutions, willing, and the only thing is exactly what she was saying, which is the education that goes into play, especially with the amount of hiring that's going on for manual contact tracers, like how to use them and what is the process, etc. But we've seen a tremendous uptake as well for the test registration and the contact tracing. It's a Dynamics app. So this is the Sarah also mentioned that these apps existed before. It's a matter of specializing them to this particular pandemic. And in the case of our lightweight case management system, which is based on Dynamics, this is exactly what the team did. So it was super quick to kind of put in the schemas for the needed for the questionnaires, as well as for the workflow that public health officials wanted their contact tracers to follow. So we can second the experience here as well.
And I would say, just to add on to what you're saying, Rafa, because I think this is really important, is we work with Microsoft Dynamics a lot of, in some of the places that we've set up, that is the sort of end database that we're pushing into. And I think what's going to be really important as we move forward is how do we connect what's best about the technology? How can we say to a state or a municipality that already has Microsoft Dynamics, hey, we can help scale what you're doing. We can reduce the cost of what you're doing and work together so that you, whether it's public health, a university, whatever, you are really using technology to save money, to use contact tracers in the best way, to do case management in the best way. I don't know if you, Brett, if you have looked at the cost if we actually did manual contact tracing, even for a town of 100,000 people, would be $12.5 million to pay for contact tracers at an average cost of $50K a year. There's not many towns in the United States of 100,000 people that can afford anything or anywhere near that. And so it's going to be so important that all of us in technology who are working on this problem are working on it to save money and save lives.
That's a really good point. Last month, CDC Director Redfield testified before both chambers, the Senate Health Committee and House Energy and Commerce Committee, that, this number's thrown around a lot, that we think we need about 100,000 contact tracers to really get this under control. At that time, a month ago, and I haven't seen an updated number, I think we have about 30,000. So there's a huge delta there. And just like you said, Sarah, there's not funding at the state level to do that. State governments are trying to maintain their own budgets and revenues with all the other questions going on. So there are actually proposals from candidates in an election year and other members that pardon my take on this, but it's like the jobs program is, hey, it's contact tracing. Here it is. Here's how we get people reemployed. So it's very interesting to watch all of this play out. So I want to take pieces of what you all said, and that there are different solutions out there And it really takes, especially in this environment, some working together. So we see a lot of good, some people trying to take advantage, just like in any situation, but there are different technologies that have emerged. Gregory, you alluded to the different solutions out there. The one you read the most about is the sort of Apple-Google partnership and their API. And I think Microsoft has built some solutions based on that. But more or less, there's this, all right, there's the ability to follow people's transactions if they grant access, also where they're going, and location tracking is either GPS, which most apps we use on a daily basis use, or Bluetooth, which allows for some more privacy-friendly features. So that underlying question of privacy, I wanted to ask how you are approaching those, the sort of opt-in, opt-out. Sarah, you said you guys started with opt-in, so I might start with you, but how you're approaching that, and then how is the issue being managed and dealt with? It seems like it is everyone's concern that, oh my data, but there's also this giant public health need where, going back to my example, I didn't have an option to not answer this contact tracer, right? I guess I could have hung up, but in the interest of, my fellow men here and women and children, I've been home, I haven't exposed anyone, and I hope we test negative, right? So there's this difference, but, people are wary of technology companies. So I'm curious how you guys are approaching that, what you've seen, and how it's playing out. Sarah, if you want to start.
Let me respond one thing, Brett, just to ensure that we all have the right information. Actually, Microsoft is not developing a contact tracing application.
I'm sorry about that. I misunderstood.
Yeah.
I apologize.
No, I just wanted, because we're being recorded, and for
Sure.
our colleagues joining here the call, I wanted just to make sure that we set the records straight. But to your point, though, so we are volunteering sometime to help University of Washington create apps. Two, actually, one which is based on the Apple Google Bluetooth Exposure API, and the other is the Common Circle Assist, which is actually based on GPS tracking. And it acts as a memory aid for when you are infected, to kind of help you remember all these questions or answers to the questions. But early on at Microsoft, our Chief Privacy Officer, Julie Brill, and our CVP of Research and Incubation, Peter Lee, came out with 16 principles of privacy and what it means to kind of help end the pandemic from a Microsoft perspective. And we have a blog out. I'm happy to share the link on the chat here for our colleagues. And it really is sort of the principles by which we stand with and our own solution, the Microsoft solutions that we're creating, which is about transparency and openness and knowing sort of as a user why your data is being captured, for what purpose. Mm-hmm. And really this opt-in, like having full control of your data, is super important, and having the ability to purge it whenever you want is super important. And all of these principles form the basis upon which our solutions are built. And even the app that we're volunteering for on the Common Circle Assist part also is abiding by these principles. So we hold it true to heart. We know, as Sarah was saying, there is indeed, a concern by users when they say, when people mention contact tracing, there's an inherent concern that happens. Manual contact tracing is not private, as you know, Brett. A contact tracer will ask you, where have you been? Who did you talk to? For how long? And so the ability to create solutions that preserve people's privacy and also have them know where their data is going, and having the ability to just say, hey, delete it, is so important for gaining trust and credibility with users, and so I think this is super important as well. There is an element, a user-centric approach to creating these solutions, and a privacy-preserving way for the underlying platform, like on be it HIPAA compliant, having FedRAMP, having all the certification that make it secure. These are all necessary things that technology companies are doing. Microsoft, at least I can speak for Microsoft, is doing to ensure that we're not dealing with people's data willy-nilly here. We are aware and we want them under their full control, and we want to secure that data. So, Greg, did you want to add, chime in here and add?
Well, I mean, I think, the one thing that I want to highlight is that, Microsoft is very much a platform company. Our mission is to empower every person and every organization on the planet to achieve more. And so, we provide that platform. We provide the security, to the data and the certifications that Rafa mentioned. And so it's our partners, our volunteers within Microsoft that have helped to innovate and deliver, solutions. And a lot of those we make publicly available, open source on GitHub. So, I mean, for as a platform company, privacy and security is of utmost importance to us, and that's woven into the fabric of who we are and what we do. Sarah?
Thanks, Gregory. I think there's three things that I would emphasize around this privacy issue, because it has become, I think the press a little bit has gotten people worked up. And I think there's three big things. One is communication. The second is confidence and confidentiality. And the third is choice. Because we don't have sort of a national perspective on how this should be done, or a national push. It's really a local, state, and above. There's so much confusion about why we're contact tracing, what we're doing, where your data might go. Is it safe? Is it not safe? We need to have a lot more emphasis and a lot more consistency around how we are communicating about why we're doing this and why it's the right thing to do. And then when I think people get more comfortable, and when you give them options and assure the confidentiality of their information that they are handing over to a survey, a program, an app, a manual tracer, that is so key that they know it's there and it's being used for the right reasons. And then I think you have to have choices. There are going to be people who would rather do something through an app, but a lot of people may want to do something through a survey or through some other means, and other people who will never reach through any technology because they're homeless, because they don't own that equipment. And so making sure, as all of us come together to work on this, that we have the right choices and are thinking about diversity and equity and everything else that's also a really sort of hot issue and important issue. I think that's going to be critical. So those are the three things around privacy.
Right. I love the three C's that you laid out: communication, confidentiality, and choice. I think that's a very good way to approach it. So building off of that, this underlying privacy issue gets into whether or not, and definitely a lot of this being driven by the media, for better or worse, of adoption, and this underlying question of whether or not people will use the technology if they don't trust it. We'll put that aside. What I've read over the last few days is two different conflicting things. One out of Oxford University saying, if you're going to use technology, you need 60% adoption to actually make it effective. I saw a conflicting report out of MIT saying you actually don't need 60%, it's much lower than that. So I'm curious if either of you have experienced, either sort of internal analysis you've done to how much use you would need for one of your technologies to actually make it, incredibly effective. or if there are different places where you're deployed where you've seen sort of the disparate levels of adoption.
So I'll jump in on this one. As I mentioned, we've seen anywhere from a 90% adoption of the contact tracing to a 30 to 40%. What I think becomes even more important, Brett, about this is what do you do for those people who aren't responding to technology? Rafa talked about the case management. We have case management. I think that's a really critical piece of any technology-based contact tracing system, is that you have a way to drive action and trigger an alert so we know who to go out and pull into that information circle, for lack of a better term. I think that we're never going to get 100% or 50, 60, 70% adoption on any single tool. I think the tool just has to, or the tools just really need to work together and have something built in to know who we're not reaching.
Yeah, I mean, I think what you're reading, Brett, is at least the data I've seen were mostly talking about the Apple Google Exposure API notification and automated contact tracing through Bluetooth. And there are a variety of different percentages being thrown out there. I can't comment on this per se myself, but I agree with Sarah. The baseline is to have means for manual contact tracing. I mean, so this is kind of baseline. If we don't have contact tracing, at least in a manual fashion, we cannot flatten the curve and stop, transmission rate. So that's kind of the baseline that we work off of. And at Microsoft, we've tried to at least empower public health to have the baseline, basically. What is between exactly what Sarah's talking about here, between the test registration to the case management system to even tracking hotspots and where they are, that's baseline. And then how we get the community to adopt anything beyond this is really gonna rely on building trust in the technology. And this is, these cultural things take time. It's hard to kind of flip a coin and say you're going to have 100% adoption. It's just not going to happen. So how to build credibility? And I go back to Sarah and the privacy principles of Microsoft. Unless you can demonstrate transparency, openness, and full control, it's extremely hard to gain credibility. So technology has to kind of demonstrate these principles, I think, for communities to take them on. And the more technology companies that outfront are privacy preserving, the more credibility you build. So.
Yep, it's that.
I was just going to say, what I think, because the news right now is so hard, I think what's exciting and potentially positive about what's happening and about the fact that health departments and other both governmental and employer organizations are adopting this technology is that the comfort level with using technology within health environments will improve. We will see more use cases, whether that's stratifying who gets the vaccine first, understanding who's had the vaccine, who might have immunity, utilizing these systems for other health crises. Hopefully no more pandemics in my lifetime, please. But I think that more and more public health organizations are going to gain comfort in the fact through things like transparency, that these are tools that can help achieve population health goals.
Thank you both, or all three of you for that. There was one question that's popped up in the group chat. It's been about the sort of privacy and trust that we've been talking about. So I think we've covered that. But I wanted to ask, building on this, your experiences and a little bit of what you were just talking about, Sarah. Could you talk about what you would say is the greatest successes that you've had in working with your customers, whether they're individual practices or communities or departments in states or counties, and then on the other side, if there have been major barriers that you've seen. We've talked about the privacy and trust on that more consumer side, but are there conflicting state laws that you've had to navigate, or are there federal laws that inhibit the ability of things to roll out? I'd love to hear from both of you on those. Sort of the successes and then problems that you foresee.
So we've been fortunate that we haven't seen necessarily the barriers. So we don't, I would imagine both of us, all of us are able to work in every municipality, state, and even at the federal level. I think the barriers have been educating public health departments on what to invest money in and why and how these things are not a one and done. So there's a huge amount of education, and we can see when we interact with people in sort of the pre-sales process how much educating we're doing, how much education some of our competitors are doing, but recognizing that that's an important part of all of this. I think our successes have been in helping the communities and seeing the communities really adapt the whole spectrum of our solution, including testing, including contact tracing, including symptom checking. We're working actively with a number of major universities because that's the big thing right now. I mean, what are we going to do about getting students either back to school and understanding how they're feeling about it? What's the wellness aspect? What's the teaching and learning, as well as K through 12? So this is something where the wins and the issues are constantly evolving. I think that's what makes it interesting and exciting to be a part of change, and to be a part of improvement.
Great, thank you. Before we turn to Microsoft, I just want to encourage those that have joined us, if you have questions, please put them in the chat, and we'll go through them as we can in the remaining minutes. So Gregory, Rafa, if you wanted to take on the sort of successes and barriers you've seen.
Sure. On the success side, I'll start by just reiterating the success of the Microsoft employees that by being supported by our Microsoft disaster response and philanthropies, we had well over 1,000 people that have helped to deliver solutions and help customers globally implement solutions in response to the COVID-19 pandemic. And my apologies for that. And as part of that, we some of our crisis response solutions, we partnered with organizations like United Health Group and University of Washington in order to take those solutions one step further. And with UHG, their Protect Well solution for returning to work. And so on a success side, it's that giving spirit that our employees had, and we we're able to provide a lot of our services and solutions gratis for organizations around the globe. From a barriers perspective, they vary greatly state to state. Technology adoption was a challenge. Organizations, agencies that were just very outdated on the technology landscape had some initial challenges to overcome, but were quick to adopt the technology through the support from our resources in order to just take on a lot of that burden. But one of the things that I also want to highlight from a barrier perspective, and we've seen this with just the challenges with reporting on the COVID-19 data, is the lack of standards, lack of data interoperability and data standards for how do the public health departments collect the information, store the information, and then share that information. So, knowing a little bit about the some of the processes that are happening at state levels and the federal level, bringing that information in from all the state agencies has been terribly difficult, and prone to being breaking, just by minor changes to a state health department's website. So that's one of those barriers. It's a technology barrier, but without adequate funding going forward, there's a risk that those barriers won't be overcome. And if and when there is another pandemic, we might find ourselves in the same boat, trying to get a handle on the pandemic quickly and being able to rely on the information that's being shared and disseminated.
And that is an overarching theme for everyone on the line of the lack of standards, lack of a common language or network across health data sharing, and a lot of issues I know many folks have worked on for years. So unsurprising, and I just kind of have to sadly nod my head when I hear people say that. So I haven't seen any other questions come in. I only have a couple more minutes. I'm not sure if I can fit these both in, but I'm curious if either of you have done work internationally, and if you have seen differences in how other countries have employed contact tracing versus what's being done in the US, and if there's anything to be learned from that.
We did a lot of work initially with public health solutions internationally, which, as Gregor said, gratis. We had a lot of free solutions that we put out. In addition, we are a part of SAP and worked closely with SAP on some of their solutions that they have rolled out in Germany and in some other areas. It is a very different environment. I think it's a different environment both because of some strict regulatory requirements around privacy.
Yeah.
I also think both in Europe and EMEA, as well as in APJ, there is a different mentality and has been a different mentality around a government saying or suggesting that a technology be used to help the country, to help the culture, to help society. That's a leadership thing that is and feels like it's been a little bit more predominant in other areas, which has made some technology adoption more successful.
Yep.
So from my perspective, I unfortunately don't have any exposure to contact tracing outside the U.S. Supported a number of organizations internationally, but it was mostly from our bot technology platform perspective. Rafa, you have any exposure there on contact tracing?
No, but I do relate to what Sarah is saying. We collaborate through our academic partnership with the University of Washington and our cryptography team there, as well as with a lot of cryptographers from across Europe. And secondhand information, they relay what Sarah is saying, which is it's a very different culture and a very different approach to disaster management in general at the national level. So secondhand information, but I don't have any personal experience.
Thank you. The last thing I wanted to say is if you had closing thoughts on what should we be adopting in terms of tracing or other solutions from a technology perspective to have in place. And we all hope this doesn't happen again, but so we're better prepared rather than, innovation is great, but to some extent this should be adopted. And Ali, if I'm I need to be cut off, feel free to cut me off.
I think that's a great last question. We are at time, but I won't stop the recording. I'd like to hear the answers, and then we'll just say thank you and go ahead.
I would just say quickly, I think that we have always been, or on the public health side, the epidemiology of the disease has been a big driver around contact tracing. And while I agree that all of the details and the data that is collected for research, for thought leadership, for understanding things is critical, if this continues, or if it happens again, we need to be very quick and focused on what information we actually need, how we're going to use it, and get it done. So there is going to be some tension there, but that's where I see this type of work going.
Thank you.
And my hope is, as a closing remark, that I hope we never face a new pandemic, but if it does happen, that this experience across the board worldwide is setting us to be more successful in the future from a time to market perspective, like time to react and time to put the tooling in place. And also culturally that we, just know what to do. That's my hope.
And then the one thing I want to just close with, and Sarah mentioned the education piece earlier, but from an education perspective, I think it's really the technology adoption, the embracing the advantages that technology has and can bring to bear, both from an agency perspective, from a public health agency, but also from a individual perspective, because as part of the pandemic, not enough effort or focus from my perspective has been put into the behavioral health impacts of the isolationism. And I think by educating consumers, educating them on the benefits to adopting the technology solutions that are being brought to bear, and then the fact that you can help engage those community members more actively, you may have an opportunity to actually combat some of the behavioral health impacts of the pandemic by bringing that information to them and helping to engage them and keep them up to date on everything. So my parting remarks.
Got it. Well, thank you to all of you for joining us today. Thanks especially to our panelists for walking us through all that, answering my questions, and for the discussion, particularly for the work that you're doing all around the country and for free in many places. We are very, very grateful and thankful for all that you guys do. So I hope everyone has a good and safe rest of their day and week. Thanks again for joining us.
Thank you.
Thanks all.
Thank you.